I see a lot of patients that reach out to me after having undergone stature lengthening surgery at other institutions. The industry is really fraught with institutions and doctors that sometimes provide suboptimal care and actually cause harm to a lot of patients out there. This is why those of us who are focused on safety have the responsibility to ensure patients get the safest possible surgery out there. This is why I've created 5 questions that you should be asking your surgeon when you're embarking on the journey. And the reason that you should ask these questions is to analyze the answers to determine whether this is a safe place to have your surgery or not. The first question is, should I have the surgery done? And the short answer is, it is not the surgeon's decision. So I, as the surgeon, can advise you on the techniques, I can advise you on what would be deemed safe from a surgical perspective, but the ultimate decision to have the surgery or not resides with you as the patient. The second question you must ask your surgeon is, how much height can I gain? In my hands, in my practice, this is a nuanced answer that includes a clinical assessment, the x-rays that we do, and an overall discussion around safety. But as a general guideline, most patients can tolerate 6.5 centimeters of femoral lengthening and 4.5 centimeters of tibial lengthening. Of course, we can increase these numbers in specific individuals, but those are the safe numbers. The third question I would like you to ask your surgeon is, do you see complications? And I will be the first surgeon to admit that complications are relatively common in this surgery, but that permanent damage from these complications can be quite rare, depending on how your surgeon responds to these complications. It's really important, firstly, to try and limit the amount of complications that occur, but secondly, to respond to them if they occur and to limit the damage, to return the patient in the same state as where we started from. The fourth question you need to ask is, who will be looking after me during and after the surgery? And the answer with me is very simple. I'm the person that is going to be looking after you throughout your journey. I take the primary responsibility. You have the skin in the game in terms of your limbs and your life. I have the skin in the game in terms of my reputation. So I will be there holding your hand throughout this journey every step of the way. And I do not take that responsibility lightly, and I do not defer this responsibility to somebody else. The fifth and last question you need to ask your surgeon is, can I negotiate the fee? This is a cheeky question because it's designed to test how unscrupulous your surgeon is. If your surgeon says yes, I can give you a lower fee in return for better write-ups on social media, then you need to be very, very careful. This surgery comes at a premium, it comes at a cost, because there's a minimum standard of quality that is built into this. You need a surgeon that is of decent quality, you need equipment that is of good quality, you need a hospital that is accredited and that has all the safety mechanisms built into it, and it needs people to run the system, experts in physiotherapy, experts in nursing, experts in nutrition, and all of these team members that are experts in their respective fields cost money. So put it bluntly, what you pay is what you get. And in broad terms, being able to negotiate fees and drop down fees to accommodate the patient's wishes is not necessarily safe practice. So these are my top 5 questions you should be asking your prospective surgeon when you're embarking on this journey, and they are intended to try and keep you as safe as possible.